There's lots of racial disparity as we talk about among women who have hypertensive disorder pregnancy. And we specifically talk about HDPs. It's not a kind of a simple answer in terms of, oh, maybe this is one thing or the other thing. So you look at what actually is going on at the level of your hospital. We found that when the patients were coming in with a diagnosis of any kind of high blood pressure in pregnancy, there was really a general lack of knowledge among patients. We really wanted to look at this increasing awareness and education, not just for the providers, but also for the patients. So as a result of all of that, we created this program and we called it STAMPP-HTN. So one of the principal goals that we started out was we were really committed to quality improvement. This was the original cohort that we had, about 926 people. We found like really just systematic reduction of blood pressure throughout from the time that the patient was delivered all the way till 6 weeks. We found a significant increase in the patients who were coming back for their postpartum hypertension follow-up visits. We had increase in the rates of follow-up for both groups of our patients, but this disparity of about 23% existed. So the difference between previously and now what we're doing is that all patients currently are getting a blood pressure monitor, but now it's Bluetooth enabled. And the beauty of that is that when it's a Bluetooth enabled blood pressure cuff, it automatically is sending blood pressures from the patient's monitor into the Epic system directly. With COVID, we converted all our first appointments, all the blood pressure appointments into phone visits. That really eliminated the disparity. So STAMP telehealth was fantastic in eliminating the disparity. And subsequent to that, now that we have the remote patient monitoring program, it's further increased to 88%.
As an African-American woman myself and a mom, it's so impactful to listen to you speak. I've experienced some of what you're describing. And, as a clinician, as a person who's able to advocate for myself, I really couldn't emphasize just how much value even I would benefit from a program such as what you have. The priority around health equity continues to grow. A lot of health systems are aligning with both CMS and Joint Commission requirements and remote patient monitoring as a great intervention to help you address, social determinants of health barriers.
The benefit of RPM that I personally feel is one that we were really scrambling to get the blood pressures at cuffs physically in this amount. So we had to physically write emails to, for example, a company and say, okay, can you please give us blood pressure cuffs? And we need like 80 per month. The good news is that a lot of those things that I had to invent because they didn't exist are already existing. So your workflows are existing, your protocols are existing, your escalations are existing, access to blood pressure cuff is existing, educational programs are existing. So you just have to put all of this together, get the buy-in and put it in place.